DREDF presents Healthcare Stories. Dr. Clarissa Kripke, Gordon Reetz, Susan Lee, and Aaron Reetz. Part 5. Interviewed at the Ed Roberts campus, Berkeley, California, October 2012. The sound of Aaron paging through books can be heard throughout the interview.
I really can't imagine somebody going out without a doctor that has such care and dedication and long hours of work to do what she's done, and it's I wish them well in finding a doctor like Dr. Kripke, but that's been our great fortune.
I really appreciate your kind words. There have been policy papers written by every major organization, the National Council on Disability, the Institute of Medicine, the Centers for Disease Control, the World Health Organization, the Surgeon General, about healthcare for people with disabilities and people with developmental disabilities. And they all come to the same conclusion, which is that we need to train healthcare providers. The major barrier to making that happen is funding, not just for the training and for teaching clinics, but funding for people to do the work, because we can't develop training programs if people can't make a living with the current healthcare finance systems.
He has not been this healthy consistently ever in his life, in terms of colds and falls and stitches and just all the things that, you know, to some extent all the things that kids have when he was littler, but certainly him, since his balance is not great. This past few years have been the healthiest time of his whole life. So it's definitely been good for him, the combination of Dr. Kripke and his living situation, where there's a lot of interaction and very much eyes on, and so it's been great.
Healthcare Stories, made possible with generous support from the Special Hope Foundation. For more information, visit dredf.org/healthcare-stories. This work is licensed under a Creative Commons Attribution, Non-Commercial, Share-alike 3.0 Unported license.